Hi everyone, my name is Mark Chigerwe, and I'd like to welcome you to the 12th Annual Pre-Medical and Pre-Health Science Professional National Conference. Thank you so much to coming to our panel focusing on large animal veterinarians. And first of all, I'd like to thank our sponsorship for this conference, AAMC, for making it possible to record these kind of panels to be broadcast globally. So for the past 6 months, we have been collecting questions from undergraduate pre-vet students through our various social media platforms and our website. As a result, we will not be accepting questions from the audience. The large animal veterinarians sitting on this panel have a combined total of 45 letters after their name. In my opinion, this might be one of the most impressive crop of veterinarians that share the job title, large animal veterinarian. Here are the veterinarians that protect our food supply, care for our horses, and drive far distances to provide quality veterinary care to those in rural communities. And I'd like to start with Dr. Magdesian introducing himself and what species you work on, and what the letters mean after your name mean.
Welcome, everybody. I'm Gary Magdesian. I'm a faculty member here at UC Davis at the veterinary school, and I work on primarily on horses. I do a little bit of work on camelids as well, so llamas and alpacas as well. And my specialty is emergency and critical care, so I work on the really sick, critically ill patients. And you wanted me to go through
Briefly, yes.
the letters behind my name. I'm board certified in 3 specialties. One of those is internal medicine. The second one is in emergency and critical care. And the third one is in clinical pharmacology.
I'm Alana McQuarry, and I'm a private practitioner. I have my own mobile practice, Happy Trails Veterinary Services, and as part of that, I work on a number of different species. I work on dogs, cats, horses, cows, goats, sheep, pigs, pretty much a little bit of everything. And as part of my practice, I do house calls. I also work for other veterinarians at their practice doing relief services. And in my 10 years, I've done small animal, emergency, mixed practice, a little bit of everything. I don't have nearly as many letters behind my name as Dr. Magdesian. I do have an MPVM, which is a master's in preventive veterinary medicine. And what that is, that's a 1-year degree that I tacked on to my DVM here, and it focuses on population health, preventive medicine, learn a lot about statistics and epidemiology, and the 2 main groups that went through the program are people with an interest in population health, and that is usually considered livestock, but there are certainly other thoughts as far as shelter medicine, and then people with wildlife interest, because you're definitely looking at a population there as well.
My name is Munashe Chigerwe, and I'm one of the faculty members here at UC Davis. And I work only with livestock, so cattle, sheep, goats, and pigs. The letters in front of my name, I have a master's in public health, and I have a PhD in immunology, and I am board certified in large animal internal medicine.
Well, thank you so much for your explanations. And I would like to open the discussion with a question about career challenges. What has been the greatest challenge in your journey to become a large animal veterinarian? What did you do to overcome that challenge to become the success you are today? And the lucky first person will be Dr. Chigerwe.
I think maybe 1 or 2 challenges, that I came across before becoming a veterinarian. I mean, as you guys can tell, I do have a different accent, so I'm not from here. I was born in Africa, and I was raised there, and I went to vet school there, so it was a challenge to go to school and pay my tuition. But I grew up on a village farm, so I pretty much worked with livestock as well as donkeys, and I mean, that was as close as I could get to horses. And then after graduating from vet school, of course, it was a challenge to move to another country. But I mean, I got help along the way, and I think you guys, you do have a shot, at coming to vet school and doing it better. if I could do it, I'm sure everybody in this room can do it as well.
Next. Anybody would like to go next?
Sure, me. So as far as challenges to get to where I am today, I think one of the overlying themes in veterinary medicine at this point in time is tuition cost. I did not come from a well-off background, so there was definitely a lot that went into simply getting into vet school and paying the tuition. I'm now 20 years away from getting it all paid off. So, and that is something that has definitely directed some of my veterinary choices. One of the jobs that I worked at for a while was with the Department of Food and Agriculture in the state of California. Very interesting job, let me use my epidemiology, and I got to meet some really interesting people, but the finances as far as being able to actually pay my bills and do the work was something that led me off into another direction. At this point, I think I've found a pretty good balance between doing relief services, doing my own house calls, and getting a chance to see a number of different species, all the while paying my bills. But that's definitely something that I think you should go into with your eyes wide open as far as how much it's going to take and how long it's going to take you to pay that off, and whether that is going to influence where you live, where you work, what you do. I think at this stage, it's important to not only dream big, but also think about some of the realities. So, but I think it's a great career choice and definitely worthwhile.
My biggest obstacle was probably being an introvert, and that was a tough thing in the short term to get through the vet school interview process. To get to know people from which I could obtain reference letters. And then as I progressed through veterinary school, it was a challenge to interact with some clients, for example. And it was a pretty big obstacle for me, and the way I got around it was I was very, very determined to become a veterinarian, so I immersed myself in situations that were out of my comfort zone. In other words, I forced myself to sort of be in the public eye, and so I volunteered to be on student club, organizing committees, and eventually even the administrative position, so I was president of a lot of student clubs, and that was really challenging for a strong introvert. And it's allowed me now to become a professor, so I stand up and lecture to large groups of people today, and I did it through determination and first of all, recognizing the obstacle, and then secondly, forcing myself out of that comfort zone and just accustoming myself to those situations like this one, for example.
Great, thank you so much for your honest answers. I like to start off my panels with more interaction, and a lot of the veterinarians are asking who's in the audience. So in terms of claps, I'm going to ask a following question so the veterinarians can gauge who's in the audience. Okay? So clap if you come from a farming background or live in a rural community. Clap if you come from a urban city. Okay. And my last question is, clap if you own a horse. Okay. So thank you so much. So now the veterinarians can frame their answers to fit the audience. So my next question specifically is for Dr. McQuarry. As a private practitioner of the panel, what's it like to run your own mobile practice and wear many different hats other than veterinarian?
It's a big challenge, and it's something that I actually started officially my own house call practice 2 years ago. I've been doing relief services and essentially working for myself in that capacity for about 7 years. And the challenges that you don't realize going into it is how much time you're going to spend doing business, how much time you're going to spend doing client communication, and how just a very small percentage, initially particularly, is going to be spent on actual medicine. And for me, in the last couple of years, I've probably, with my own practice, spent 70% of my time on business things and maybe 30% on the actual medicine. And I think the good balance for a sole business owner would be maybe 25% of my time spent on business. And so I'm still working towards that. And keep in mind that I don't even have any official employees. I've had my mother answering phones, which is its own challenge. And I'm going to be getting another girl that's going to be doing that more regularly. I'd like to second the introversion comments, because that's definitely a place that I come from as well. And so going through and each new interaction with a new client is always a challenge. And that's something that I think a lot of people initially get into veterinary medicine thinking, oh, I'm just going to go play with animals and the clients are just going to be off somewhere in the distance. And particularly with mobile practice, particularly with house calls, the clients are right there. They are not going anywhere, and they may be your only assistants to help with whatever procedure you're doing. And they may be very anxious, they may be very upset, they may also be really excellent help. So, but definitely, I think the business and communications are probably the biggest challenges, and thinking about all of the different things that ancillary support staff do that you take for granted as an associate veterinarian, all of a sudden you are the person that is doing all of those tasks, and you really realize the value of a good registered veterinary technician. You realize the extreme value of a good receptionist, and appreciate that a whole lot more.
Thank you so much. It's really interesting. And my next question is, what are some ways pre-vet students interested in large animal medicine to gain veterinary clinical experience? And I would like, Dr. Magdesian, would you like to start us off on this topic?
I would encourage each of you to gain as much varied experience as possible. So don't just focus on the species that you're interested in. In other words, if you want to become an equine veterinarian, make sure to get experience with small animals and with livestock as well, and even wildlife, because that shows that you're a person with an open mind and that you're willing to sort of go outside of the species that you're most comfortable with when you do ultimately interview. So I would encourage you to get as much varied experience as possible, and then try and do some ride-alongs with mobile veterinarians. And
sorry to interrupt. Can you explain what is a ride-along?
Okay, good question. A ride-along is somebody who is riding in the truck with a veterinarian, and so you go to the house calls, the ranch calls with the veterinarian, and learn from them and assist with some of the procedures or with restraint, and basically you're learning by observing in that case. And then that person can potentially become a reference for you for your application as well. So my biggest advice would be to get as much varied experience as possible. Don't just focus on the species that you're most interested in.
Any of the other panelists like to jump in or add something?
I would definitely like to second that. I went through vet school 10 years ago and was food animal track. I think, are we not tracking anymore?
Streams.
Yeah,
Similar.
streams. Oh, that's fun. So it's something where I, at that point in time, fully expected to work primarily on beef cows, maybe a few horses. Thought, well, I'll take the medicine and do the other things just in case. And here I am 10 years later working on all of these different species, and I go back to my education and go back to the fact that even if you don't work on that species, you may take some of those techniques from one species to another species and be able to jump into that situation. Every day you learn something new in veterinary medicine. And even if you think you're just going to go play with cows, go get a job at a small animal clinic doing kennels. And one of the experiences that I did was in my undergrad, I was at the University of Arizona and did a lot of work with the animal science department and spent time on the dairy and spent time in the horse barn. UC Davis has a wonderful undergrad animal science program, and there are a lot of schools out there that have really, really good animal science programs. So getting involved in those units on campus where you've actually got professors that can help guide you is also good in addition to the ride-alongs.
share?
Yeah, and I think in addition to what Dr. Magdesian is said, is one of the other things that you could do, regardless of the school where you are for your undergrad, is to seek some opportunities for research as well. You find that, a lot of professors are doing some research with some animals, be it large animal or small animal. If you get a chance to sort of, volunteer or work in their labs or even raise the animals and everything like that, you probably gain some experience, and you also get to know a little bit about the vet school or those departments that you're working with, and then it sort of connects you with people as well, and that's really helps when it comes to getting experience.
Great, that's really insightful. Are you guys taking notes? So, on the same note, I would like to direct a specific question to Dr. Magdesian. Is large animal medicine a field of veterinary medicine that one can make great gains quickly if they are inspired and passionate? Because often pre-vets I talk to discover their passion for large animal very late in their life and feels intimidated by peers who've grown up on farms or been riding horses since they were kids. And as a result, these kids feel hopeless because they feel they won't catch up.
Yeah, that's a great question, and not uncommon scenario where somebody thinks they're going to be a small animal veterinarian and they get into vet school and realize that they really like horses or really like cattle, and they don't feel like they can make the change at that point because their classmates who are in those fields have grown up around them, or they were raised on a ranch, for example, or had horses since they were a child. But my answer to that is yes, absolutely, it is possible. But I'll be honest, it's an extra challenge. It's going to take extra effort on your part if you decide to do that. And by that I mean you're going to have to immerse yourself in all the aspects surrounding the field of that species. And by that I mean, let's say you decide you want to do equine medicine and you've never worked around horses. Well, for your own safety as well as your client's safety, you're going to have to learn how to handle horses, number one. Number two, clients won't call you out if you're not familiar with horse handling, horse health, basic horse health,
Lingo.
management, the horse lingo, very good point. And so you're going to have to volunteer at a stable, not just with a veterinarian, but at a stable, at a breeding farm, at a racing training facility, and learn the lingo, learn how to clean a stall, for example, learn how to put a halter on, how to safely walk a horse. Take riding lessons if you can to learn basics about riding, because I'll tell you, it's a practice builder if you can relate to the clients and talk to them about their specific breed of horse, for example. If you can ask them about a horse show and carry on a conversation and relate to them, it's going to be a practice builder. On the other hand, if you don't know anything about how to handle horses or how to manage horses or what the equine industry is all about, it doesn't matter how good a vet you are, they won't call you out because they want somebody that they can relate to that will understand their horse from not only a medical standpoint but also basic husbandry. How do you feed it? How much do you feed it? What do you feed it? What sort of training mechanisms are there for horses? What the show world is all about. So I would really encourage you, if you decide later in life to switch species, to really immerse yourself. And immerse means you're basically dunking yourself into the ocean of the industry of that species. If you're gonna if you want to become a beef veterinarian, for example, then you should not only ride along with a beef cattle veterinarian, but also volunteer on a cattle ranch. Try to volunteer on a dairy if you can, and learn as much about cattle from the ground up as you can. But it is definitely possible if you're willing to put that extra effort and determination in.
Are there any panelists that disagree with that comment or that idea?
I completely agree with that. I actually came from a city background where I never saw cows, sheep, goats, horses, pigs until I got into high school, and got very involved in FFA in high school, and that's where I really decided large animal was the thing for me. So you definitely can, but you absolutely have to immerse yourself, and more than the medicine will come, and if you don't know everything about the medicine, you can refer. So, there are super smart people, but it's the communication, it's the client communication, it's being able to relate to them that is going to have them call you back and is going to help you develop a long-term relationship with them. So, and that just takes effort and time and spending time in that environment.
Anyone else like to add anything, or no? Great. So you're saying, all of you, that a pre-vet student you can teach skills, you can teach techniques, but you can't teach attitude.
Definitely.
Yeah, okay. And my next question is specifically for Dr. Chigerwe, because he is faculty at the School of Veterinary Medicine. What do you look for in students who contact you to request for research opportunities or a ride-along?
It's kind of hard to sort of figure out, what kind of a student somebody is, before you hire them for help, or you hire them to help you with the research and actually and pay them. So one of the things that I do usually when a student is seeking opportunities to work on my research or is just looking for somebody else to give them more experience in livestock is I really want to meet the students first, and I really want to get an idea of what exactly they want to learn from, be it research or ride along. So they're going to give me some outcomes. In other words, they have to tell me that, after these 2 weeks with the ride along or after these 2 weeks on your service, I want to be able to know the behavior of livestock, be able to restrain them, and so on. So, and usually, after a couple of minutes of discussion with that student, it's very easy to tell apart the students who really, really want to get some experience with something. They know exactly what they want to get, compared to the ones that are just trying to get experience where they can put it on their CV when they apply to vet school. So after 10, 15 minutes, you can actually tell the students that really want to learn something because they know exactly what they want to learn, and they know exactly how they're going to be when they finish those 2 weeks or 4 weeks. So sitting down with them for a couple of minutes really is a good way of just finding out what they want to learn.
So you essentially just can't fake it.
No, you can. You can. I mean, we're probably too old for that. It's easy to tell.
Okay. So I'd like to jump into another question that's addressed to all the panelists. Unlike in small animal medicine, veterinarians who practice large animal medicine face a greater chance of getting injured. I mean, when I was doing my dairy medicine internship, they told me that a large animal veterinarian's body is similar to a dancer because they only have a certain years they can pack in before their bodies tends to wear down. So how do you overcome, or how do you cope with that idea that maybe the next time you go into an appointment or see an animal that can potentially cause a career-ending injury? And I'd like to start off with anyone who is ready.
All right, I'll speak up. So as far as I'm concerned, I am acutely aware of trying to make sure I don't get injured, and one of the big things that I do on house calls, especially for large animals, is if I'm going out to, say, do a breeding soundness evaluation, I want to know that they have a working chute. If they don't have a working chute, the call is not worth it to me to get myself hurt for a couple of dollars. And so the other thing is you do need to be absolutely aware of your body in space and aware of where you're standing. Livestock and horses are actually, and for me, I feel safer around them than I do around some cats, because cats can twist and turn and do anything they want to do, and you don't quite know what's going to happen. Whereas with horses and cattle, most of the time, if you know where you're standing and you know where your body is and you know how they're going to move, which all comes from just being around those animals and watching them, then you can put yourself in a safe space. And also knowing who is around you to help you. And if you have a trained, experienced client, one of my clients is an animal control officer, I trust her implicitly. Whereas if I have someone that just decided they wanted to get a horse and they've got 6 months of experience, I'm going to be a lot more hesitant around that client. I'm not going to necessarily push things as much. I'm going to jump faster to sedation of animals. Chemical restraint can be a very, very good way to not get injured. So it's really being aware of yourself and being aware of who you're working with and where you're working, and not letting yourself get into the really dangerous situations. It's not worth it.
Anyone else like to jump in?
So I work mostly with students when patients are being admitted to the clinic, and they all have different experiences in terms of, knowing behavior of livestock and or knowing how to restrain them. I think one of the most important thing that I always make sure happens is, whenever you have an animal, whether it's docile or not, is to make sure that everybody understands what's going to happen, okay? If you're going to restrain a bull with a chute, everybody needs to know that, as well as knowing your exit points as well, be it jumping over a gate or being it like going under a table or something like that. So you gotta be able to explain to everybody around that if something happens, okay, if this animal becomes fractious, this is the way we're gonna handle that. You're gonna run through that door, I'm gonna get run over, and nobody else should get run over by that calf. So always make sure that everybody knows what's gonna happen when you're restraining that animal. So it really helps that, everybody's on the same page when restraining animals. So, but I mean, it's true that, being a large animal vet, the probability of getting injured is quite high compared to working with other species. And at times you can't avoid it because you're trying to save somebody, or maybe you're the only one who's getting paid. So you probably want to save everybody who's not getting paid. But I really echo her comments that, sometimes it's not worth it if there's no good restraint for that animal.
Would you like to jump in, Dr. Magdesian?
Yeah, for a number of years after I graduated, I never really paid too much attention to safety and my body, and I was fortunate I didn't get injured until one day I did get injured, and I hurt my back from a draft horse foal, and had to get physical therapy, and it was really enlightening. The physical therapist taught me how to properly lift heavy objects, for example, or how I might safely hold up a horse's leg, or use my shoulders and back safely. And these are things that when I went through school, there was no training about how to safely use your body to work around large animals. And even now, I don't know that we provide a large amount of that. And so I would encourage you to learn how to properly use your body. And you don't have to have a physical therapist do that. You can get a lot of the basics online or through textbooks and self-learn, just some basics about how to lift heavy objects, how to pull heavy things, and such. And then secondly, I would echo the notion that you should have really safe restraint, which means the person holding the horse should be capable of holding that particular horse. So if it's a really fractious horse and the owner is obviously not capable of restraining that horse, then sometimes I'll just take the horse away and just work on it by myself, because that's safer for me and the client and the horse than having an owner who's unsure or nervous about the circumstances. And then chemical restraint as well for the large animal species. If I find that a circumstance is making me uncomfortable and that getting concerned that somebody may get hurt here, then I'll reach for chemical restraint, meaning sedatives, to help with the situation.
Okay. Thank you so much. Another question for the panel. I was really surprised that this category showed up frequently in the large animal medicine Google Doc. Was I mean, for me, my Achilles heel, my science prerequisite was biochem. And I remember right before an exam, I called my veterinary mentor and it's like, I'm really nervous for the exam. And it's like, I didn't tell him yet. And he asked me, he's like, okay, I'll pray for you. And I was like, it's biochem. I'll pray even harder. I asked him why. I was horrible at biochem, but look at me now, Mark. I got through it. So one of the questions that led to this was, could you please mention the hardest science prerequisite you ever encountered in undergrad, and how did you overcome that obstacle? And I'd like to start with Dr. McQuarry.
I hated physics. Physics was a terrible, terrible class for me. Thankfully, I did not go into radiology, so it's something that has really become an ancillary thing in my life. I got through it simply day to day and knowing that it was 2 semesters of my life, and I studied enough to get through, and then I was done, and it was all okay. So you can get through anything, you just have to take it one day at a time.
Still thinking?
Does it have to be in sciences? Or-
Okay, let's try the liberal arts.
For me, it was a speech class, and just having to get up and speak in front of people. That was the most difficult class, again, because I was fairly introverted and shy.
And Dr. Chigerwe?
Actually, I had a hard time in literature and English. So I took English language because, of course, English is not my first language. And I also took literature and English. I mean, other than Shakespeare, I didn't enjoy anything else in that class.
Okay, great. So my question is for Dr. Magdesian, and I wanted to know, what was the most expensive horse you ever worked on, and what do you do to it?
The most expensive horse that I worked on was a racehorse in California. I can't give any personal information about it, but it was a fairly well-known racehorse in California, and I had to do a spleen biopsy on it. That made me quite nervous because the spleen is a highly vascular organ that has a tendency to bleed quite a bit.
Okay, great. And I know Dr. Chigerwe, he mentioned he works on pigs, but you work on a special kind of pig that comes through the Food Animal Service frequently. Could you elaborate on what kind of special pig that comes through?
So we see sort of different types of pigs. So we see occasionally we see commercial pigs, and these are mostly forage programs. So these are the commercial pigs that you would see everywhere, and they kind of seasonal, so we tend to see them just before state fairs. But then we also see companion pigs, and most of these are pot-belly pigs, and I would say probably those are the majority of patients that we see as pigs, because they're kept as pets. I mean, the age range is from 1 year to 25 years of age, so they can be pretty old. But this kind of like the type of pigs that we see.
Okay, great, thank you. My next question is for addressed to the panel, and because both of you are faculty and Dr. McQuarry is a private practitioner, you sometimes deal with students that request for ride-alongs. So if all these students just got accepted to a ride-along from a large animal veterinarian, what would you give your #1 tip to survive that day and make a good impression on that large animal veterinarian so they can get a second call?
Pay attention to what's going on. That would be the most important thing, is be engaged, be involved, and know where you are, know where you're standing. Don't come up and stand in front of the squeeze chute, and don't come up and stand where you're going to get kicked by the horse. Nobody wants you to get injured, and I think all of us want you to have a good experience, have a good time, enjoy yourself, learn a lot. And then second to that would be engaged, ask questions, just really try to immerse yourself in the day and get as much out of it as you possibly can.
Anything you'd like to add to that?
I look for 3 things. One is work ethic. So somebody who works really hard and is not afraid to do the menial things. By that I mean jump in there, don't wait to be asked. Jump in there and clean the buckets, or wipe down the instruments that were used. Anything that's going to show the veterinarian that you're really determined and you work hard and you want to work hard. The second is enthusiasm, so a positive attitude, somebody who's passionate about what they're going to do, so show interest, ask questions, but do so in the truck, not in front of the client. Okay, so that's really important. Is carry on conversations with the veterinarian in the truck, or if you're at a clinic, do so behind the scenes, not in front of the client, because you don't want to appear disrespectful or like you're questioning the veterinarian in front of the client. And the third thing is somebody who's respectful and has good interpersonal skills. So be mindful of what you say and how you say it.
Okay. Would you like to add anything or no? Okay. I'm surprised all three of you didn't mention bring a sack lunch.
We just expect you won't eat all day.
That's one of the prerequisites.
You have to be able to fast.
Getting through the day with no lunch.
Mm-hmm. Also, get a good night of sleep. It's not looking good if you fall asleep in the truck. So my next question is, with the rising cost of tuition and veterinary school and the high debt load with veterinary students, would you recommend large animal medicine at this point to a pre-vet student, knowing the amount of debt load and the new schools opening up? Don't be shy, you have tenure.
For me, it depends. It's really something where all of your career choices, you have to decide what's going to be best for you. If your primary goal in life is to drive a nice car, live in a great house, and have an easy work-life balance where you take vacations regularly, probably not. If your true passion is to spend your time talking to clients, relating to clients, helping them through their crises, and doing some medicine along with your client communication, and absolutely, I think it can be a wonderful career path. As far as the cost of tuition, the cost of living, it is something that's scary, and I think there are different areas in large animal medicine that are going to maybe give you an easier time paying your debt off. I've got a classmate that's down in South Central Valley doing dairy practice, and I think that's an area where if you're in the right part of the country, you can make a decent living. You're not going to be rich. In any of these careers, you're not going to be rich. Academia, not rich. Private practice, not really rich. So, that you need to decide what your focus is in life and what your goals are in life, and what's going to make you happy each day and what's going to make you content to get up. No job is easy, and every job is work, and if this is something that you have a passion for, that you wake up with just a big smile on your face, and you love talking to 4-H'ers and FFA'ers and seeing their animals and helping that animal out of that crisis, it's a great career path. But it's definitely something that comes with its own set of challenges. And one of the ways that I've tried to reconcile the challenges is I've done small animal emergency practice that pays a little bit better. I've done relief work, which pays a little bit better. And so I'm able to balance out my finances with my desire to work on livestock. And in my area, I really view my livestock and horse work as ancillary to my other things, because I don't want to have every client visit be dictated by the finances and me doing all of these things simply so I can pay my bills. So I pick and choose my clients, and I do that as part of my life. So there's lots of different ways that you can go about crafting your life, and you need to decide what's going to make you happy each day.
Anything else one want to add to that?
Well, I agree with you that, there's no such better feeling of getting up in the morning and not being grumpy, and then go to work and then have fun. For me, have fun with the students and talk to clients, help your patients, and then go home and feel that, It was a good day. But I mean, on the other hand, probably when you go to the bank, to look at your account, it might not be as many thousands as you want. But I think I would take, the happiness of having a job that I enjoy than the sadness of having too much money in my bank account. So, I mean, as Dr. McQuarry said, you have to enjoy what you're doing, and then you have to sort of be very open-minded in terms of what you're going to do when things are not adding up. So if you decide that you're going to do a mixed animal practice with just equine and livestock, and it turns out that, you're not able to pay your bills with that, maybe then make a plan B that maybe you might want to probably include, small animal practice in your life as well, so that you can pay the bills and still enjoy working with large animals.
Yeah, it's a really difficult question, especially today. It's really difficult because the debt to income ratio is so high. In other words, students are graduating with higher debts than ever before. And so I don't answer that question lightly when somebody asks me about it, and I ask them how much time they have and whether they have a few minutes to actually discuss it, because you have to ask yourself why you're doing it. And if one of the biggest reasons is the income, then you shouldn't do it for that reason. If it's a passion of yours and the salary is not of the utmost importance, and I always tell people there's always room for exceptional people. So even in a field that's impacted, if you're an exceptional person, a very hardworking, inspired, passionate, talented person, there's going to be room somewhere for you. So I always ask, what's the reason you're doing it? And then the second question is, are you flexible in terms of lifestyle? Because a large animal veterinarian may necessitate that you live somewhere you may not necessarily want to. It may not be your first choice place to live because you have to move to the jobs. Whereas in small animal medicine, for example, you can get a job virtually anywhere. Every city has small animal clinics. But if you're looking for a large animal job, you're going to have to be willing to go to the job. Sometimes that might mean out of state or in a rural area that you don't necessarily want to live in. So a lot of factors come into play. And then the third thing is how well you like to work with people. And as Dr. McQuarry alluded to earlier, a lot of students want to go into veterinary medicine. They say, well, I don't want to work on people. I don't want to be a human doctor. Well, then I say, are you sure you want to be a veterinarian? Because humans are attached to animals, and they're emotionally attached or financially attached, which means you have to do a lot of, probably most of my day is dealing with people, not with animals. And so if the answers to all those questions are still, yes, I want to be a large animal veterinarian, then I'm absolutely supportive of that.
Okay. Thank you so much. And these answers really make me apparent that I'm so glad I recruited these three veterinarians to talk about large animal medicine. My final question today is, I want to end really light and funny, is I'm always interested in pick the brains of large animal veterinarians, is what's your favorite large animal to work on? For Dr. Magdesian, you can go somewhere specific. What kind of breed of horse do you like to work on?
My favorite breed of horse is American paint horse, so that's the breed I like to work on, and the favorite age group is the newborn foal, the young foals.
I like lots of different things. If I have to be pinned down today my answer is going to be goats. They have great personalities. They are generally pretty easy to work on and relatively easy to restrain. And their problems tend to be sorted out fairly easily. So they're fun, but every species has their own unique characteristics. My favorite horse of all time was actually a little mini baby this guy passed around in neonatology 10 years ago, which was just an awesome day.
I have to say a cow, and because I think cows do two things that I wish I could do. As you guys know, that cows can chew their cud, so they can eat stuff and then bring it up again, and chew it again. So, which is really interesting. So I always think about, on Thanksgiving, if I could eat like that cheesecake and then bring it up again, then I don't have to eat more cheesecake because I can keep eating the same one, a couple of times. And cows can also lick the inside of their nose, and I wish I could do that. and then I don't have to buy Kleenex. So, so I think cow is my favorite for sure.
Okay. Well, give me another round of applause to our large animal vets.